The next thing I like to assess is root tension. So in order to assess the so-called straight leg raise, which is probably best demonstrated from over here. So first of all, we want to make sure there's no problem with the hip. So I bend the thigh upwards, get the hip flexed, and then just check that there's a good range of pain-free movement of the hip. Because remember, there's a big overlap in patients with back problems and hip problems. And some patients who you think initially may have a back problem, it turns out that the underlying problem is with the hip. So always check the movements of the hip, abduction and adduction, feeling for any movement of the pelvis. Okay, so Tom's hip is moving nicely. Now I know that, it's safe to do a straight leg raise. And in the straight leg raise, essentially what you're doing is stretching the sciatic nerve and the nerve roots as they exit the lumbar spine. So as I lift the leg up, like so, a patient who's got radicular compression will develop pain that radiates all the way down the leg, often felt in the back as well, at a certain degree of elevation. Now that might be very low, at 20 degrees or so. It may not be until they're up at 60, 70 degrees. But the positive test is one in which the patient has pain in the back and the leg, which is brought on by raising the leg up and then is relieved by lowering it down. And as a further test of that, if you dorsiflex at the ankle, that puts a further stretch on the sciatic nerve, and a patient who's got irritation, compression of the lumbar nerve root the pain will be increased by dorsiflexion at the foot. Okay, you pop your leg down for me. Some of the patients that you'll be assessing with back problems are likely to be elderly patients who may have lumbar canal stenosis. Remember, this is the group of patients who present with neurogenic claudication, and by that we mean a combination of pain in the back, sometimes in the buttocks and down the back of the legs, made worse by walking and relieved by sitting down or bending forwards. Some of those patients, the symptoms of neurogenic claudication can be confused with the symptoms of vascular claudication, and so in this group of the group of more elderly patients, I always like to check that the peripheral pulses are present. So I feel for the dorsalis pedis pulse and the posterior tibial, and check that they are both present.